floods, fires, terrorism.
And it documented security cameras recorded the attack, which left 71 people dead.
Collapsing buildings. How safe are you? How prepared are you to prevent your loved ones from these disasters? These are some of the occurrences you see dotting our news by interested media around the world.
We have seen over the last few years issues to do with coordination of the meager resources that are available for deployment, being these that especially for sudden onset disasters where we have little time for planning.
Safety and security have been elusive in the past as a result of poor disaster prevention and management in Kenya.
The issue was about mass casualty incidents, sudden onset disasters, management of resources and coordination of the actors. We are talking of the guys involved in search and rescue. We are talking of guys involved in firefighting. We are talking of guys involved in medical evacuation. We are talking about hospitals. We are talking about the media. We are talking about traffic and security, access, crowd control, even feeding the responders and mobilizing the community. So it is a whole range of activities that are involved in disaster management.
Different reports have in the past termed Kenya's disaster preparedness as poorly coordinated and unnecessarily expensive, a reality that currently plagues many counties outside the capital, Nairobi.
If we do not have a functioning trauma care system or pre-hospital care system in place before the disaster occurs, then we will not be successful in minimizing the mortality or death, and as important, the amount of injury and the severity of those injuries that could occur.
There's a chain of command, and through this chain of command, if anyone comes to the incident site, we report to the command post, report to the incident commander. Like what happens at the Westgate, it didn't come out clearly. There's no proper incident management system whereby there's no competition, there's professionalism, there's a lot of teamwork. Any person reporting the incident must check in and check out. That's what we call accountability.
Now we are looking at how do we coordinate as actors on this. So due to this is now when we sit down and said, can we sit down and start now preparing a national stakeholder MCI protocol?
The challenges to put in place a comprehensive framework became a battle that disaster management and risk reduction groups are currently fighting. This was the drive for establishing the Mass Casualty Incident or MCI protocol.
The incident command system provides a common platform for all types of responders for all types of events, and the development of the MCI protocol allows for multi-agencies at multi-levels to use that common platform to respond efficiently to a disaster.
You don't manage incident by crisis. You have to manage incidents by objectives. So through incident command system, incidents are managed by objectives rather than being managed by crisis. And you'll find there's no competition. All stakeholders work under one leader. Leadership, coordination, command and control is key.
You need to understand that what capacity does each of these hospitals have. Then you say, fine, already from the disaster plan, you already know Nairobi Hospital has 7 trauma rooms, Aga Khan has 5, MP Shah has 4. So you already know how many you can send to all the different hospitals. It's trying to ensure that you save as many lives as possible.
They receive prompt care, ideally in less than 30 minutes. They receive care in their transportation to the hospital. When they arrive at the hospital, the individuals and the infrastructure is in place so that patients can be cared for definitively, correctly, and in a timely manner. Ideally, a primary care system, if it is to be comprehensive, should also include rehabilitation. So these patients should go on, if they have a broken limb, if they have other physical conditions which may limit their returning to the activities of daily living, a rehabilitation should be in place to help with that. So this comprehensive system can help to ensure that when a disaster happens, its impact will be minimized.
Consequently, the National Disaster Management Unit, institutions like Red Cross, hospitals, Kenya Defence Forces, St. John, Center for Disease Control and Prevention, among other partners, ranging from security, medical and research institutions, came together for a joint simulation of the MCI protocol.
We were simulating an explosion inside a story building in a busy town. An explosion goes up. There are people trapped inside. Then now we have the standby police or police on patrol discovering this, then calling on for backup. Then we have now the continuous crowd control by the police.
You'll understand that all of us are needed, but not at the same time. You'll find that when people learn about ICS, they'll know that I might go to that incident, but not now. My time is not reached. If I am supposed to do something, is my objective ready to go and deal with it now? If not, I'll come at the right time.
The first guys are the fire guys, and before any responders can go in, then the hazmat guys are coming in to check on the hazardous material for that building, because we don't know the nature of explosion and all that. So once they clear, that's now when they allow in the first aiders or the first responders to go in, and then they start evacuating people. We are seeing now the activation with ambulance services, triage, now referral to secondary hospitals, and we are seeing many hospitals now activating on their capacity and that response.
Once you've triaged at the incident, they now called around to all the other hospitals and say, I have an incident on the ground. They already have the numbers for all the hospitals. They already know how many currently they have. Then the person at the disaster has already called and said, how many ICU beds do you have? So while they are triaging, they already know that MP Shah can take 4 ICU patients. Then if you look at Aga Khan, they've already coordinated that. So that coordination needs to be there. We need to have a centralized disaster center that says, yes, this is the hospitals you're taking them to.
Then the issue of now air evacuation, even with people now maybe specialized treatment, and then that brings us down to who is where and what is acting, and then we bring all the actors down now for a match past of all the players.
By training the groups together, they establish practical systems that aid in laying the framework for efficient disaster management.
We have seen this of the incident commander when he had a building collapse last year in Huruma, whereby all stakeholders used the same protocols and managed the incident properly, successfully. It's the same Huruma building collapse. We have had a lot of other disasters like the Mandera, the Kariza, and others which I don't even mention because there are many. We have managed using the ICS and the disaster risk management exercise planning. We have used the same, the skills and knowledge gained through that.
Makongeni, the building collapsed almost around 3 in the morning, and by within an hour, all actors had mobilized, working with the National Disaster Operations Center, had activated. Almost all actors were on the ground, and by 6 the first briefing happened between all the actors, with NDMU commanding the post, NDOC continuously activating and coordinating all the responses, Kenya Red Cross and St. John's Ambulance handling the medical evacuation, NYS and KDF handling the search and rescue and breaking of the rubbles and all those kind of things, the community with the Songo rescue team and all the others mobilizing resources and food for the responders, and by 6:30 we had the first media briefing.
The result is, with the institutions already following well-structured and well-coordinated efforts, disaster preparation and management bodies will greatly succeed in extending such knowledge to the public and policy levels in the counties.
This exercise wasn't the final thing, right? This continues to grow and develop, and you exercise it to refine it. The idea would then be to from the national level, introduce it to the county levels.
What we did in Embakasi was what should happen at the national level, and we are hoping this will be demystified all the counties.
We need more training of such nature so that this country can have nearly in every sub-county, not even a county, sub-county, even community, special teams, because incident management requires time. If there is a threat like the terrorism threat, people are somewhere taken captive, they require to be relieved shortest time as possible. So we don't need even to transporting people far locations.
Now to fly the critical patients from Garissa to here, it's an hour. You're going to lose the patient. Most likely you're going to lose it. So what you need to do is decentralize and ensure that staffing and all that is available. You have to ensure that medical care is not just based in Nairobi. We are a big country.